So ectropion is basically the opposite of entropion. Ectropion means that that square edge of the eyelid, instead of being nicely positioned against the eyeball, is falling out or falling away. And so people with ectropion oftentimes are less symptomatic than those with entropion because you don't have anything rubbing on the surface of the eyelid. The eyelids are really just not staying nice and tightly opposed to the eyeball as they should be in ectropion. So you can certainly still get some irritation. This is more so because, normally the eyelids function as a windshield wiper. And so when you blink, they do a really nice job of spreading the tears. But when you have an ectropion and the eyelid has kind of fallen away from the eyeball, it doesn't do as good of a windshield wiper job. And so the wetting of the surface of the eye is not as even as it would be in an ideal situation. And so this is where a little bit of that irritation comes from. If the eyelid is really sitting a long ways away from the eyeball, it's also not getting wetted with the tears. And so it can become dried out and it can become red and inflamed, which can be, bothersome from an appearance standpoint. Now, there are a few different kinds of ectropion. Probably the most common that we see, again, is involutional or age-related. And this happens because the lower eyelid becomes more lax horizontally, and the vertical instability also plays a role. And so this weakness allows it to fall away from the eye. On the topic of weakness, facial nerve palsy or patients with Bell's palsy can also develop what's called a paralytic ectropion. And in this case, the reason the eyelid falls away from the eyeball is because that orbicularis muscle, the one that's responsible for blinking and closing the eyes, is weak. It's not working properly. And so it's not helping to keep things held up against the eyeball. The other kind of ectropion that can happen is called cicatricial. And cicatricial means scarring, right? So anything that causes scarring in the anterior part of the eyelid can pull that eyelid away from the eyeball. So that can include, scarring in the skin if you had a prior Mohs surgery in this area, if too much skin was removed during a lower eyelid surgery, or honestly, even just sometimes contraction of the skin from a lot of sun exposure over time can leave you with a relative shortage of skin, allowing the eyelid to sit back against the eyeball. Now, there are many different kinds of treatment for ectropion. Again, it all comes back to identifying what the underlying cause is. For cases of involutional ectropion, we do many of the same things that we do for entropion. It really comes back to trying to stabilize the eyelid both horizontally and vertically. And so usually we will tighten the eyelid horizontally and strengthen the attachment of the muscle that pulls the eyelid down so that it's more stable. If the issue with ectropion is because of a scarring or a cicatricial change, then that needs to be addressed separately, right? And so sometimes that means adding additional skin to the lower eyelid in the form of a flap or a skin graft, for example. So that might be taken from the upper eyelid or from behind the ear to provide more skin to the anterior part of the eyelid so that the eyelid can sit back against the eyeball. And then the case of paralysis, many cases of Bell's palsy will recover, right? So we want to be patient here. We don't want to jump the gun and do something surgically if we're not going to need to. So in the short term, if the facial nerve palsy is expected to recover, you can apply some tape to the lower eyelid. Here you would apply, your steri-strip in the middle of the lower eyelid and kind of sling it up to help hold the eyelid back and up against the eyeball. If the facial nerve palsy is not expected to recover, then of course there are some surgical options. Sometimes we'll tighten the lower eyelid horizontally, and in certain instances we'll actually take a little piece of fascia, often harvested from the temporal fossa up here, and use that to sling up or reinforce the position of the lower eyelid. That's in the case of a complete facial nerve palsy that is not going to recover.